Welcome to this lecture series on National Tobacco Control Program Guidelines for Training of Doctors. In this first session, we will analyze burden of tobacco use and its massive health, social and economic impact, forming foundation for effective tobacco cessation practice. Tobacco burden, global and Indian scenario. Tobacco remains the most preventable cause of disease and death across the world. Every year, millions of people die because of tobacco-related illnesses including lung cancer, COPD, heart disease and stroke. An important fact is that more than 80% of these deaths occur in developing countries. China and India alone contribute to almost 40% of world smokers. India is currently the second largest consumer and producer of tobacco. Nearly 1 million Indians die every year due to tobacco related diseases. These deaths are completely preventable. In fact, tobacco causes more deaths in India than malaria, TB, and HIV combined. Despite increasing awareness, tobacco use continues to rise in many developing countries, creating a major public health challenge. Tobacco use pattern in India. In India, tobacco is consumed in multiple forms, both smoking and smokeless. According to national surveys, more than one-third of Indian adults use tobacco in some form. A major issue in India is the widespread use of smokeless tobacco, which is even more common than smoking. Products like khaini, gutka, pan with tobacco, mishri and gal are widely used, especially in rural areas. Among smoking products, BD remains most commonly used form, followed by cigarettes and hookah. Many people wrongly believe BD or smokeless tobacco is safer than cigarette, but this is completely false. These products are strongly associated with oral cancer, lung disease, heart disease and premature death. Tobacco use is generally higher in men, although in some regions smokeless tobacco use among women is also significant. Another alarming fact is the increasing tobacco exposure among adolescents. Surveys have shown substantial tobacco use among school children between 13 to 15 years of age, highlighting the need for early prevention and awareness program. Smoking tobacco damages nearly every organ in human body. Tobacco smoke contains more than 7,000 chemicals, many of which are toxic and at least 69 are proven cancer-causing substances. These harmful chemicals include carbon monoxide, arsenic, cadmium, formaldehyde, benzene and radioactive substances like polonium-210. Smoking affects multiple body systems including lung, heart, blood vessels, brain, digestive system and reproductive system. Globally, smoking is one of the leading causes of preventable death. Studies shows that smokers lose approximately 7 to 10 years of life expectancy compared to non-smokers. Smoking is strongly associated with cancers of lung, oral cavity, larynx, esophagus, pancreas, bladder and cervix. It is also major cause of COPD, chronic bronchitis emphysema, heart disease, stroke and increased risk of tuberculosis. One important point many people underestimate is that smoking does not harm only the lungs, but it damages entire human body. Many people wrongly believe smokeless tobacco is safer than smoking. This is completely incorrect. Products like gutka, khaini, pan with tobacco, mishri and snuff are strongly linked to oral cancers and severe oral diseases. India has one of the highest rate of oral cancers in the world and tobacco is the major reason behind this burden. Smokeless tobacco can lead to gum diseases, bad breath, tooth discoloration, oral infections and a dangerous condition called oral submucosal fibrosis. In this condition, mouth gradually loses its ability to open properly and many cases later progresses to cancer. Tobacco also affects other organs and is associated with cancers of esophagus and pancreas, cardiovascular disease, infertility, and delayed wound healing. In pregnant women, tobacco exposure increases the risk of low birth weight babies and congenital defects. Key message is simple: there is no safe form of tobacco. Secondhand smoke refers to smoke inhaled by non-smokers from cigarettes, BDs, or other tobacco products. It includes both smoke exhaled by smokers and smoke released directly from burning tobacco. Many people assume that only smokers are affected, but this is false. Passive smoking can also cause serious disease. In India, exposure to secondhand smoke is very common, especially at home and public places. Women and children are particularly vulnerable because smoking rates are higher among men. In adults, secondhand smoke increases risk of lung cancer and heart disease. In children, it can worsen asthma, increase respiratory infection, reduce lung growth, and cause repeated ear infections. Exposure to secondhand smoke is also linked to sudden infant death syndrome or SIDS in infant. Important reality is this: when someone smokes near family member, the damage extends far beyond the smoker alone. Third-hand smoke refers to toxic residue left behind after a cigarette or BD has been extinguished. These chemicals remain on clothes, furniture, walls, floors, and other surfaces for a long time. This is especially dangerous for children who may absorb nicotine and other toxic substances through skin contact or by touching contaminated surfaces. Studies show that these residues can react with environmental chemicals to form tobacco-specific nitrosamines, which are among most potent cancer-causing agents. Apart from harming health, tobacco also damages environment. Tobacco farming contributes significantly to deforestation because forests are cleared for cultivation, curing, and packaging processes. Tobacco cultivation also exhausts soil nutrients rapidly and requires intensive use of pesticides and fertilizers, leading to contamination of nearby water sources. In addition, cigarette butts and tobacco product packaging creates large amount of non-biodegradable waste and environmental pollution. Tobacco creates not only a health burden but also a major socio-economic burden. Studies have shown that cost of treating tobacco-related illnesses is higher than the revenue generated through tobacco taxation. In many low-income families, money spent on tobacco reduces spending on essential needs such as food, clothing, and education. At the same time, millions are involved in tobacco cultivation and BD manufacturing, including large number of women and children, many of whom work under poor conditions with low wages. Occupational exposure to tobacco also causes serious health problems. Farmers handling wet tobacco leaves can develop green tobacco sickness due to absorption of nicotine through skin. Symptoms include nausea, vomiting, and dizziness. BD workers are constantly exposed to tobacco dust, are at increased risk of chronic lung disease and tuberculosis. Long working hours also contribute to musculoskeletal problem and skin disorders. Finally, relation between tuberculosis and tobacco. There is a strong association between tobacco use and tuberculosis. Tobacco smoke damages the lining of airways and weakens body's immune system, making individuals more vulnerable to tuberculosis infection. Studies have shown that smokers have much higher risk of developing active TB compared to non-smokers. Smoking also increases chances of relapse, treatment failure, drug resistance, and death due to tuberculosis. In India, significant portion of TB-related death among men are linked to tobacco use. This is why tobacco cessation is an important part of TB management. Patients receiving TB treatment should always be counseled to stop smoking or use tobacco in any form. Even brief counseling by healthcare workers can improve quit rates and achieve better TB treatment outcomes. Protecting TB patients from secondhand smoke exposure at home and workplaces is equally important.